one of the most common questions we hear is which came first, the mental health issue or the addiction? And the honest answer is, it depends. For some individuals, substances begin as a form of self-medication. Someone may struggle with anxiety, depression, trauma, or chronic stress long before substances enter the picture. Alcohol or drugs can temporarily numb those symptoms, but over time, they actually intensify them. For others, though, chronic substance use changes brain chemistry. Long-term use affects mood regulation, sleep, impulse control, and stress response, and what may have started as recreational use can eventually create substance-induced depression or anxiety. There are also contributing factors like trauma timelines, genetic predisposition, environmental stressors, and early onset use during adolescence. The developing brain is especially vulnerable, and early exposure can significantly impact emotional regulation later in life. The reality is, focusing too much on which came first can sometimes distract from treatment. In early recovery, it's often diagnostically challenging to separate substance-induced symptoms from primary mental health disorders, and that's why we focus on stabilization first. Long-term brain healing takes time. As substances leave the system, the brain begins recalibrating, but that neurological healing process can take weeks or even months. During that time, mood swings, anxiety, and sleep disruption are common and expected parts of recovery. That's why integrated care is so important. When we treat mental health and substance use together, rather than as separate issues, outcomes improve significantly. We're addressing the whole person, and part of our role is also educating clients about what's happening in their brain. When they understand that symptoms may be a part of the healing process, not personal failure, it reduces shame and increases motivation. Ultimately, it's less about which came first and more about building the skills, support, and structure that's needed for long-term recovery.